Hello, my name is Nura Atika. I am from Group 4. Our group have to present about disease education, which is diabetes. Diabetes refers to a group of conditions characterized by a high level of blood glucose, or can be referred as blood sugar. Large amount of sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic condition, which are type 1 diabetes and type 2 diabetes. For pregnant women, diabetes may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of baby. Prediabetes is when the blood sugar level is at the borderline, which is higher than normal but lower than in diabetics. Prediabetes may or may not progress to diabetes. During food digestion, carbohydrate will break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is the hormone produced by beta cell of the pancreas and is necessary for glucose intake by target cell. In healthy people, beta cell of the pancreas will produce insulin. Next, the insulin will bind it to its receptor on target cells and induce glucose intake. However, people with type 1 diabetes problem, the beta cell of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced, resulting less insulin bind to its receptor on target cells. So, when the less glucose is taken into the cell, the more glucose stays in the blood. Type 1 diabetics are therefore insulin dependent. Next, let's move to type 2 diabetes. For the type 2 diabetes, the pancreas produces enough insulin, but sometimes goes wrong either with receptor binding or insulin signaling inside the target cells. In type 2 diabetes, the cells are not responsive to insulin and therefore cannot import glucose. So, the glucose just stays in the blood. Compared to type 1 diabetics, type 2 diabetics are insulin resistant. Here again, genetic factors affect susceptibility for the disease, but it is believed that lifestyle plays a very important role in type 2 diabetes. Okay, so just now we already discovered about pathophysiology of diabetes. Now, let's see what are the causes and symptoms for this type of diabetes.
The cause of diabetes, regardless of its type, is having too much glucose circulating in your bloodstream. However, the reason why your blood glucose levels are high varies depending on the type of diabetes. Diabetes have two types, so type 1 and type 2. So cause of type 1 diabetes, this is an immune system disease. Your body attacks and destroys insulin producing cell in your pancreas. Without insulin to allow glucose to enter your cell, glucose builds up in your bloodstream. Genes may also play a role in some patients. Also, a virus may trigger the immune system attack. Cause of type 2 diabetes and prediabetes, your body cells don't allow insulin to work as it should to let glucose into its cell. Your body cells have become resistant to insulin. Your pancreas can keep up and make enough insulin to overcome this resistance. So glucose levels rise in your bloodstream. So what are the symptoms of diabetes? The symptoms of diabetes vary depending on how much your blood sugar rises. Some people, especially those with pre-diabetes or type 2 diabetes, sometimes have no symptoms. In type 1 diabetes, symptoms tend to come on quickly and get worse. Here are a few symptoms of diabetes. So the first one is you drink enough water but still feel thirsty. Your eyesight is blurry. You're peeing more than usual. You're exhausted no matter how much you sleep or rest. You are losing weight without even trying. You feel stubborn even though you just ate. Type 1 diabetes symptoms. Symptoms can develop quickly over a few weeks or months. Symptoms begin when you are young, as a child, teen, or young adult. Additional symptoms include nausea, vomit, or stomach pains, and yeast infections or urinary tract infections. Type 2 diabetes and pre-diabetes symptoms. So you may not have any symptoms at all or may not notice them since they develop slowly over several years. So symptoms usually begin to develop when you are an adult, but pre-diabetes and type 2 diabetes is on the rise in all age groups.
There's many diabetes drug classes. Firstly, alpha glucose inhibitor, Alcobos and miltritol are alpha glucose inhibitor. These drugs help the body to lower blood sugar level by blocking the breakdown of structures in the intestine. They also slow the breakdown of some sugars such as table sugar. Their action slow and rise in blood sugar level after a meal. They should be taken with the first bite of meal. This drug may have side effects including gas and diarrhea. Second drug classes is biguanide. Metformin is a biguanide. Biguanides lower blood sugar level primarily by decreasing the amount of glucose product by the liver. Metformin also helps to lower sugar level by making muscle tissue more sensitive to insulin, so glucose can be absorbed. It is usually taken 2 times a day. Side effect of metformin may be diarrhea, but this is improved when the drug is taken with food. Then, bile acid sequestrant. The BAS cholesterol is a cholesterol lowering medication that also reduces blood sugar level in patients with diabetes. BAS helps remove cholesterol from the body, particularly LDL cholesterol. The medication reduces LDL cholesterol by binding with bile acid in the digestive system. Because BAS are not absorbed into the bloodstream, they are usually safe for use by patients who may not be able to use other medication because of liver problem. Because of the way they work, side effects of BAS can include flatulence and constipation. Next, sodium glucose transporter 2 inhibitors. Glucose in the bloodstream passes through the kidneys where it can either be excreted or reabsorbed. Sodium glucose transporter 2 works in the kidney to reabsorb glucose, and a new class of medication, SGLT2 inhibitors, block this action, causing excess glucose to be eliminated in the urine. Because they increase glucose level in the urine, side effects can include urinary tract and yeast infections. Last one is DPP-4 inhibitors. A new class of medication called DPP-4 inhibitors help improve A1C without causing hypoglycemia. They work by preventing the breakdown of naturally occurring compound in the body. GLP-1. GLP-1 reduces blood sugar level in the body but is broken down very quickly. So this does not work well when injection as a drug itself. DPP-4 inhibitors do not tend to cause weight gain and tend to have a neutral or positive effect on cholesterol level.
There are 3 treatments. There is bariatric surgery, artificial pancreas, and pancreatic islet transplantation. Bariatric surgery, or the name is weight loss surgery. Bariatric surgery is used for obesity and type 2 diabetes. The reason bariatric surgery is needed because when we lose a lot of body weight, blood glucose can return to the normal level. However, the duration to regain blood glucose varies to the patient. Type of weight loss surgery and the amount of weight loss. This is artificial pancreas. Artificial pancreas is a man-made pancreas. The artificial pancreas system is called hybrid closed loop system. The patient has to manually adjust the amount of insulin pump. This method is suitable for every type of diabetes. The last one is pancreatic islet transplantation. This method replaces the destroyed islets with new ones from the organ donor. This method is suitable for type 1 diabetes. This method is not readily available to everyone, but only to people in research studies.
The important lifestyle changes to make in a diabetic patient is to reduce the stress levels and then increase sleeping hours. Like if the patient is sleeping for 4 to 5 hours, then definitely 6 to 7 hours proper sleep has to be maintained, and they have to maintain the timings of the sleep, and then there has to be a fixed patterns for the sleep, or if the person is sleeping around 10 or 11:30 in a day, it has to be continued all the times. Getting up at 5:30 or 6 o'clock, it doesn't mean they can go to bed 12 o'clock and wake up at 6. They have to sleep early in the morning and 30 to 40 minutes of physical activity in a day, like walking, jogging, running, anything to help reduce the sugar levels. If the person is suffering from family history of diabetes, like the parents or the mother or whatever they are having, it can be controlled, like receiving the stress, like doing meditation and yoga. Developing good habits helps reduce sugar levels, and good habits like weekly playing badminton, playing cricket, swimming also helps in reducing sugar levels. Walking around 30 to 40 minutes per day also help reducing the sugar levels. Brisk walking is better than lazy walk, and 1 hour we can walk in 5 to 6 kilometers, so it helps each and everyone to control the diabetes. So I would like to recommend you to limit carbohydrate serving. Carbohydrates include sugar, starch and fiber, and one serving is about 15 grams. People with or without diabetes should eat a diet that includes carbohydrate, particularly from whole grains, fruits, vegetables, and low-fat milk. Several studies shows that carbohydrates, no matter its source, for example, cake, corn, starch, cereals, and candy, produce about the same response in blood sugar. Therefore, it's the total amount of carbohydrates in meals and snacks that is most important, not the type of carbohydrates. And also recommend you to maintain approximately the same number of carbohydrates serving at each meal each day.